Okay, so treonin was shown in research to improve nutrient utilization by 50% in animal studies. In human studies, probably is even more effective than that, because laboratory rats have a better diet than most people generally do. So the very early days of Neolife were centered around the fact that Wally Wimmer was crippled, his wife was crippled with rheumatoid arthritis, and she recovered after 2.5 years. Fred Aldrich's wife was suffering with rheumatoid arthritis. She recovered after 8 months. And they found many, many benefits of the treonin oils. Another supplement that Neolife came out with was the lecithin and the lipotropic adjunct. Lecithin is a high quality lipid also, and that confers benefit to this, what Ravisi referred to as the lipidic defense system of the body. And lipotropic allows you to use fats properly. It actually breaks the fat into tiny little microdots so that the body can process them in the liver and get them out to the tissues for benefit. Dr. Macera did some double-blind work with the lipotropic adjunct, and he found that the lipotropic lowered cholesterol in people. With 2 a day, it tended to lower cholesterol. With 4 a day, everyone got a little drop in cholesterol. It also is 30 times more effective than lecithin in enabling the body to break down the fats and utilize them for health. Another one of the lipid supplements that Neolife came out with very early was the salmon oil. And the salmon oil is the cleanest high quality oil, fish oil supplement that's out there. It's actually tested for 200 plus pollutants with a standard of 0. And there was an 8-week clinical trial on it. And what they found was that it reduced the inflammatory index by 68% in 8 weeks. That's a pretty dramatic reduction. And really, salmon oil has 8 factors in there. One of those is DHA. DHA is essential for the resolution of inflammation. So if you happen to get a viral or a bacterial attack, the inflammation can go on for long periods of time if you don't have a resolution. So the salmon oil has the raw material you need to produce, it's called resolvins and protectants that allow inflammation to resolve. The other thing is that salmon oil has something called EPA, and EPA actually bumps arachidonic acid out of the membrane of the cell. And arachidonic acid is the fountainhead from which some of the most inflammatory compounds in the body come, particularly your leukotrienes, which have a lot of pain associated with them. Now, a lot of fish oil products have only those 2 components, but recent research is suggesting that there's other members of the omega-3 family that have benefit as well. One of those is DPA. In the original studies on salmon oil, what they found was that there was a dramatic reduction in the risk of heart disease. Well, now they think that that benefit came from the DPA, which is another of the 8 members of the omega-3 family. So the nice thing about salmon oil is it's clean and it's pure, and it has the complete complex of the omega-3s. When I talk to people about omega-3, I like to emphasize that our bodies are all loaded with toxic substances, and these toxic substances tend to want to move into our fat storage. So the issue becomes, how can we get the toxins out of the fat? And the best way to do that is to supplement with high quality lipids, because what they do is they displace the contaminated fat. So for example, let's say you have DDT, which all of us have in the fat in our bodies, and you want to get rid of it. If you supplement with salmon oil on a day-by-day basis, what that's going to do is get incorporated into the membranes of the cells, and it's going to displace fats that are contaminated with DDT. It's kind of an easy way. You know, if you fast, you burn up the fat and you release a lot of toxins. Salmon oil does a similar kind of thing to what fasting does, but it's not as hard to do as fasting would be. And over the long term, it's probably going to work even better because you're getting essential nutrients that the cells need to function. Another Neolife supplement that's based on lipids, actually, the Neolife CoQ10 is a combination of an antioxidant and also the lipids that are associated with the CoQ10 in nature. And if you study discussions that are going on right now, there's a proposal that the mitochondria are the critical factor involved in contributing to cancer. And they're tracing the defect in the cell, not to the DNA. There were some studies that were done where what they did is they took the DNA of a cancer cell and they put it in the cytoplasm of a normal cell, and the DNA became normal. In other words, the cytoplasm of a healthy cell actually healed the DNA of a cancer cell, of a nucleus. And what they are talking about is what's called retrograde signaling. In other words, the DNA is where the energy is produced in the cell. When the mitochondria is where the energy is produced in the cell. When the mitochondria are damaged, the cell cannot produce energy in order to support the life of the cell. Normally, the cell lives with oxidation, use of oxygen, produces 36 units of energy with each glucose molecule. A cancer cell can only produce 2 units of energy. And so what happens is if the mitochondria cannot produce the energy the cell needs, it sends a message to the DNA telling the cell to become a cancer cell. So that's the discussion that some people are having with regard to cancer. It's completely foreign to all of the cancer research that's gone on. But that's called retrograde signaling because normally scientists think that the DNA sends a message to the rest of the cell to become a cancer cell. But here the discussion is that the mitochondria are sending a message to the DNA telling it to become a cancer cell. What this means from a practical standpoint is that we need to really pay attention to the mitochondria where the energy is produced in the cell and make the cells healthier through the use of lipids and antioxidants that protect those lipids in the cell membrane. This is why things like juicing and carotenoids and flavonoids and vitamin E and CoQ10 seem to have a lot of anti-cancer effects. They're actually helping the mitochondria work better. Another nutrient that Neolife has that's really unique is vitamin E. Neolife from the beginning had all 8 members of the vitamin E family, 4 tocopherols and 4 tocotrienols. Most of the supplements that are sold are just alpha tocopherol. And alpha tocopherol is important for vitamin E. The body actually has a special transport to move alpha tocopherol into the bloodstream and attach it to cholesterol to prevent it from oxidizing. And we know that oxidized cholesterol is 500 times more atherogenic than non-oxidized cholesterol. So that's an important component. But a number of years ago, I had a discussion with Dr. Stephan Christen at UC Berkeley. And he maintained that you needed all the 8 members of the vitamin E family if you wanted to avoid problems. What he did is he did a study where he loaded up his animals on large amounts of synthetic alpha tocopherol, and the cancer incidence went up. And he felt that was because you were driving out of the tissue all of the gamma tocopherol and tocotrienols and whatnot, and these other substances are what protects the body from nitrogen-based carcinogens, which alpha tocopherol does not do it very effectively. So we need all the members of the vitamin E family. And one of the other things is that some of the other members of the vitamin E family actually protect you when the blood sugars go high. So that's a very, very important factor. And the vitamin E is water miscible. Vitamin E is the most expensive of the natural antioxidants. It only makes sense to water miscibilize it and dramatically improve the absorption by breaking it into tiny little dots so that you get the ultimate benefit of all of the vitamin E factors that are there. Then the final nutrient I wanted to discuss briefly was carotenoid complex. Carotenoids are the fat-soluble antioxidants found in fruits and vegetables. All of these phytonutrients, whether they're from flavonoids, the cruciferous, or carotenoids, are defense mechanisms on the parts of the plants. They're produced when plants are stressed, and the plants use these things to protect themselves. And it's been designed in nature that these same substances that protect the plants also protect us. There's a ton of research showing that carotenoids protect from cancers and a lot of other health problems as well. The New York Academy of Sciences found that the carotenoid complex is well absorbed, so they requested some of the carotenoid to study. And the result of their work was they found that there was a 20% increase in natural killer cells, just the ones that go after cancer cells. There was a 37% enhancement in lymphocyte proliferation. Now, what happens is if you have oxidative damage to the outer membrane of the cell, then it's more difficult for the cell to divide. That process is called tanning. And a number of years ago, I spoke to a group, and there was this fellow that headed up the Nucleopolar Corporation. And he said what they did in their research is they lead poisoned red blood cells and showed that they couldn't fit through the tiny capillaries anymore. And then they supplemented the animals with vitamin E, and the vitamin E allowed the red blood cells to filter through the tiny little capillaries again. And what it did is it prevented the hardening or the tanning of the cell membranes so that it remained flexible. That's why you have this enhancement of the natural killer cell activity and the lymphocyte proliferation. The immune system is actually able to work better with the carotenoids. Also, there was a 5-fold increase in antioxidants in cholesterol with supplementation. And there was a 44% reduction in oxidative damage to cells, that is the mitochondria, and other internal structures of the cell. So I think the carotenoids are very, very important from the standpoint of long-term health. And not only is it going to be protective against cancer and aging and viral and bacterial and fungal attack, but it's going to help us live an optimal lifespan. I always, our first distributor was Herman Tiburon. Herman was a fellow that had worked with my mother, his wife did, and he had a terrible problem. He couldn't grow hair on his head. He couldn't remember anything. And both he and his wife were extremely obese. And so they got on Neolife and they started on the lipotropic adjunct. And over a period of a couple of years, they lost all of their weight. Herman went from like 250 pounds to 150 pounds. He and his wife had fatty deposits all around the eyes. Those all melted away. And they both became models of health for years. When it came time for Herman to die a while back, he called up and he thanked Mom and I for introducing him to Neolife. He said, our life would have never been what it has been if it hadn't been for the discovery of these products. So I think we really do people a service by sharing Neolife with them. And with that, I'm done. I'm going to open it up to any questions you want to ask. Any questions?
Jim, can you hear me?
I can.
Okay. Everyone, if you have questions, you can put them in the chat, and then I will select what we can. And Jim, here's one question: what makes Full Motion different from other glucosamines on the market? And then after that, Jimmy, if you could do one on how to heal leaky gut and what causes it. But if we can start with what makes our Full Motion different, that's one of the questions in the chat.
Okay, well, the Full Motion is hypoallergenic. A lot of Full Motion type products are allergy provoking because of impurities within the product. Also, almost all the benefit for osteoarthritis comes from the glucosamine component. And so the Full Motion has the quantity of that that's necessary in order to address the osteoarthritis issue. What was the other question?
The other one is what causes, how do you heal leaky gut and what causes it?
Well, there's a lot of factors that contribute to leaky gut. Basically, the gut is a very thin structure. It's basically one cell thick. And there are gateways in the small intestine. And what happens is that these gateways are regulated by certain nutrients like vitamin D and zinc. So if you happen to be deficient in zinc or vitamin D, then you're going to be absorbing foods that you do not digest. And when you digest, you absorb food that you don't digest, it initiates an inflammatory response. That inflammatory response then further opens up the gate in the gut, and you get more and more inflammation and absorption of undigested foods, and it kind of builds on itself. So what I usually do is I'll encourage people to do lots of antioxidants, vitamin E, carotenoid, vitamin C, salmon oil, and juicing is very helpful. Aloe is very, very helpful for leaky gut.
Is vitamin A very important, or protein, for leaky gut, Jimmy?
Vitamin A is very important. that actually is one of the deficiencies that can contribute to leaky gut. So that one definitely. What was the other?
Would protein or shake be
protein
important?
Yeah, one of the problems with leaky gut is that there's a problem with protein digestion. So the Neolife protein, because it's broken down with enzymes, it's going to provide the protein that the person needs without taxing the digestive apparatus. So I would definitely encourage someone to use the protein. I like the vegan protein. Probably any of the proteins would work well, though.
Okay. And here's another question. It says, our grandson has been sick with a clogged sinus since the beginning of school. What can I do to help this go away?
Well, not a doctor, so I don't know what's going on there. But basically, when you have a problem that goes on and on, what you need to do is try and find out what's causing the problem. Now, that could be a food allergy. It could be a nutrient deficiency. So what I would do is experiment with the diet, change the foods, and then I would do some heavy supplementation with things that would benefit the respiratory tract. You could do things like vitamin A and E, salmon oil. You could do herbal respiratory, Resp 11, or Resp 10. All of these types of nutrients. And I would look very carefully at common allergens. For example, dairy very frequently is involved with sinus congestion. And you have to ask yourself, is there gluten in the diet? Is there dairy? Is there corn? Usually people will indicate if they have intolerance to a food, it will be indicated by the fact that they go crazy over that food and they have to have it all the time. So the key is to get them to avoid it for a period of time and see if the symptoms don't clear.
Okay. Okay. And what can I do that says to lower elevated cortisol level and keep it under check?
Well, cortisol levels can be reduced by exercise and also by adequate sleep. One of the things that tends to elevate cortisol is if you have excessive electromagnetic fields in the environment. So turn off the Wi-Fi at night. Don't keep the cell phone by the bed. And that will probably help as well. Also avoid sugar. Sugar elevates cortisol levels 3 to 4-fold. Caffeine 5-fold. Strong emotional stress 6-fold increase in cortisol levels. So all of those have to be looked at.
Very, very good. Okay. And this says, are you familiar with a bladder condition called interstitial cystitis? If so, what do you recommend to help it for interstitial cystitis? Well,
the fact that it's cystitis indicates that it's an inflammatory condition. So the first thing you want to do is work on anti-inflammatories, salmon oil, vitamin C, vitamin E, carotenoid. And another thing you can do is there's a website called vitasearch.com. You can get on there and you can look up interstitial cystitis, see if there's any specific nutrients. I'm not aware of any other specifics that would help that, but it's something that could be pursued.
Okay. What would be a supplement to use to stop cluster headaches?
Well, it depends on what the cause of the cluster headaches happen to be. There's some research that is indicating that EMFs cause headaches, chronic headaches. Also, food allergies can do that. So you need to pin down what is triggering the problem. I would work on reducing the EMF in the environment. I do a lot of salmon oil. I do some vitamin E, carotenoid complex, lecithin, lipotropic adjunct, and pretty high dose vitamin C as well.
Okay, okay. And let's see here. Found another one. Are there reasons why iron may be low other than diet? And is there any concern with taking omega-3 plus when using a blood thinner?
Well, if you're using a blood thinner, run it by your doctor. I don't think there's a great risk of using small amounts of the salmon oil. But if you're using large amounts, you definitely want to run it by your doctor because it is a blood thinner. Generally, salmon oil is a lot safer than most of the blood thinners. I know a fellow was living with me here. He was on a blood thinner and he fell and cut himself, and he had severe blood loss because they could not stop the bleeding. So that's a real problem.
Is small amount, Jimmy, is 3 a small amount, or is that?
Yeah, I wouldn't, if you're on a blood thinner, I wouldn't go over the label recommendation.
Okay. Okay. Just so everyone knows, 3 salmon oil capsules is equal to 1 serving of salmon. That's the equivalent. And then, Jim,
Yeah,
are there...
the government recommendation on fish intake is 2 servings a week. So you would want to do at least the equivalent of 2 servings of fish a week.
Okay. And then let's see here. Are there reasons why iron may be low other than diet?
Yes, there are a number of reasons why iron can be low. Probably the most common reasons why iron is low is because a person has low hydrochloric acid production in the stomach. And if you don't have your hydrochloric acid, you cannot acidify the iron and absorb it. So low HCl in the stomach, which is resolved by beta-gest, would pick up the iron. The other thing is there are certain disease conditions where the body sequesters iron. So even though the iron may not be deficient, when you test for the iron, it appears to be low. So those conditions are cancer and rheumatoid arthritis and diabetes. In those situations, the body tends to sequester iron so that the blood levels can appear low. And it's just that the body is trying to keep the iron away from bacteria that are causing problems. Rheumatoid arthritis, there's an underlying infection very often in that. Diabetes, you got high blood sugar, so the bacteria will feed on that. So the body wants to hide the iron from the bacteria. So that's another factor involved in low iron.
Okay. And here's a question. What is the best way to lower blood pressure?
Best way to lower blood pressure. Well, there's a number of things that lower blood pressure. Vitamin E actually will tend to lower blood pressure. The 3 biggies are salmon oil. Salmon oil is very effective in opening up the circulation. And vitamin E also opens up the circulation, particularly the E complex, because of the nitric oxide. Magnesium is a vasodilator, and that tends to help with blood pressure. And then the other one is vitamin D. And you need a good level of vitamin D to properly utilize magnesium. And most of the time, attention to those 4 nutrients will bring the blood pressure down.
Okay, I missed one of them. One is salmon oil. Oh, and then magnesium, vitamin E, and what was the 4th one? I'm sorry.
D is in dog.
Okay, D. Okay, very good. Did you say E is also a factor, as in Edward, or?
Yes.
Okay, so E, D, magnesium, and salmon oil would be your 4 most likely to help a blood pressure situation, Jimmy?
Yes, also avoiding sugar.
Oh, wow, okay.
It's probably the hardest of all. Yeah, what they found was that nitric oxide lowers blood pressure. The problem with nitric oxide, which, by the way, Dr. First was studying nitric oxide at the time of his death. It was way back in 2005 before anyone had heard of it. And what they have found is that some of the tocotrienols and gamma-tocopherol and whatnot, what they do is they prolong the half-life of nitric oxide. So they make it more effective at dilating the blood vessels and improving the circulation.
Okay. Here's another question. What?
That lowers blood pressure.
Okay. This says lipotropic seems to increase my blood pressure. Is that possible? And if so, why?
Well, anything's possible. I don't know why lipotropic might increase blood pressure, other than the fact that if you have a lot of fat in the liver, the lipotropic is going to start breaking up that fat, and you're going to tend to get a temporary increase in blood pressure as these fats are winding up in the circulation and being eliminated from the body. That'd be the only thing I could think of that was contributing to that.
Oh, okay. And then you talked about how to help leaky gut. Could you elaborate just a little bit more on what causes leaky gut?
There's a tight junction in the gut, and it's regulated by vitamin D. So when you're D deficient, that tight junction opens up. Also, we know that gluten opens the tight junction in the gut. So if someone is allergic to gluten, they're going to have leaky gut. Also, if you have any kind of inflammatory response going on in the body, let's say you're allergic to corn or dairy or something like that, that creates an inflammatory response, and the inflammatory response will open up the gut to invasion. Diet has a lot to do with this. There's something called a lipopolysaccharide, LPS, and this is produced in your gut when you eat certain kinds of foods. It's kind of the high-fat junk foods, like when you have a bag of potato chips or something like that. You get a dramatic rise in LPS. LPS is the byproduct of the cell membranes of bacteria. It's extremely inflammatory, and it's known to trigger leaky gut. So trying to avoid junky foods and eating a really healthy diet usually is very helpful in dealing with that leaky gut syndrome.
Okay, very good.
Sugars are a key contributor to leaky gut too.
And
feed all the wrong kind of bacteria.
And I remember you said that sugar is very definitely inflammatory too, correct, Tim?
Yes, highly inflammatory.
Okay. Here's a question.
The reason why sugar is inflammatory is because what it does is sugar has the ability to bond with structures in the body. So it's called glycosylation. What happens is the sugar will bond with maybe joint tissue or gut tissue, something like that, and it changes the structure of the proteins. And then the immune system looks at that altered protein and says, that's not normal, we need to attack it. So because a lot of the sugar winds up in the gut, you can get a lot of autoimmune attack against the body's own gut lining when you're eating a lot of sugar. That's going to increase the inflammation that leads to the leaky gut.
Okay, this says, is there a diet-related tie between fat accumulation and body survival?
I'm not sure what the point of that question is.
Yeah, I'm not sure either. I'm just reading it straight as it says. Let's go to another one then. This says, I don't understand the E and nitric oxide connection. Please clarify.
Okay. Nitric oxide is a vasodilator. So what it does is it opens up all the circulation. When you have low levels of nitric oxide, you get a shutdown of the circulation, blood pressure tends to go up. The vitamin E complex has different members that help the production of nitric oxide. And the specific one there is the gamma tocopherol and also a couple of the tocotrienols. So nitric oxide is very important from the standpoint of improving the circulation. The alpha tocopherol does not open up the circulation, it just prevents oxidation of the cholesterol in the circulatory system. The other thing that gamma tocopherol does is there are certain free radicals that are produced within the body from nitrogen-based sources. The gamma tocopherols and other members of the vitamin E family, and I have a whole newsletter on this, you can go to my website and read, but the gamma tocopherol prevents the nitrogen compounds from moving to becoming carcinogens. And at the same time, they channel the nitric compounds into nitric oxide, which is actually beneficial.
And our Neolife E would promote nitric oxide then, is that right? That's one.
Yeah, the Neolife complex has all of the members of the E family.
Awesome, awesome. And so then that's going to promote nitric oxide production.
Yes.
Wonderful, fantastic. Okay, and then here's one. Are some of the alternative flours such as nut, coconut, or bean flours as bad for us as white flour?
Probably not. I haven't really studied that. With regard to the nitric oxide, there I wanted to point out also that Trey is very supportive of nitric oxide as well.
Okay.
It really benefits the circulation.
All right, very good. Here's one. What do you recommend for recovering from issues from having COVID, loss of taste and smell and hair loss?
I think you're going to want to do general nutrition, lots of protein. I don't know that it matters too much which one, but what I would do is I would do protein, and then I would do like a Pro Vitality and a Prime Pack, something like that, some salmon oil, and give it some time.
Okay. And then this one has a few parts. One of the parts is once someone has Well, what are the best things to prevent COVID and then optimize overcoming COVID once a person gets it?
I think your best prevention is high dose vitamin D.
Okay.
And adequate zinc and high dose vitamin C, lots of antioxidants. And then once you've got it, you want to do the same type thing. You want to, I would try and get some ivermectin if I came down with COVID, which I did. And I found the ivermectin very helpful. I did high dose vitamin C several times a day. Basically, what I did is I made a protein shake with the vegan protein, added vitamin C to it. And I did a Pro Vitality and a Prime Pack on a daily basis. High dose vitamin D, about 10,000 I use a day. And flavonoids, and a bunch of other supplements that I just grabbed out of the cabinet.
Okay, but they should focus on, Jimmy, on high dose D, zinc, C. And since COVID often affects lungs, would you say A is real important to help them recover too?
Yes, unfortunately, I didn't have any A up here, so I'm glad I didn't come down with the lung aspect to it. But yeah, vitamin A is very helpful also.
Okay. Very good. I'm looking for a few more questions here.
I found the COVID was worse the first 2 days, 2 or 3 days. I did not take ivermectin the first day. I wasn't sure I had it. By the second day, I was sure I had it, ivermectin. And within 2 days of the time I took the ivermectin, the pain that was throughout the body was gone. And it was just a matter of trying to maintain with the vitamin C and other nutrients.
Okay. Very good. Is there a nutritional way to address tinnitus? Is another question here.
What is that?
Is there a nutritional way to address tinnitus?
Tendonitis?
Tinnitus, I think, like ringing.
Tinnitus.
Yeah.
There's some discussion that maybe magnesium or vitamin D3 can help. Usually tinnitus is caused by exposure to excessively loud noises or by some type of damage to the inner ear. So you can try the nutrition and see if it helps.
Okay, and then if someone asked you what the top 2 or 3 things that would set Neolife apart from other companies, I remember you said we don't use pine bark, which is wonderful. You know, like things we like to stay in the human food chain. Are there 2 or 3 things that would be right at the top of your mind on what makes us different from other companies?
Well, one of the key ones is products are designed to be digested and absorbed. Now you see that with the vitamin E, with the water miscibility. But Neolife also has all the digestive aids, the beta-gestin enzyme. Enzymes are very anti-inflammatory. And by the way, that was something that really helped me with the COVID too, is the enzymes. Also, the carotenoid, if you look at the carotenoid, what they have done is they take steps to protect the carotenoids from exposure to free radical oxygen. So they have a black capsule because light destroys carotenoids. And they process it in a nitrogen environment because oxygen destroys carotenoids. So they have this Nutrimax process that assures potency on the carotenoid complex. With regard to the salmon oil, they have a unique technology. It's called molecular differentiation. And what they do is they have the ability to go through the omega-3 and they can look at specific molecules. So they can pull out substances that are oxidative fats. They can pull out rancidity factors. They can pull out toxins. So that's how you wind up with the cleanest fish oil product on the market. And it has an ultra high potency concentrate. And what that means is that you can have a very tiny capsule and still get the full potency from that capsule that you would get from a much larger salmon oil supplement. And that's important for a lot of people because not everyone can swallow big capsules.
Jim, do you know if there's any other omega-3 products on all the market that have all 8 like us, or are we the only one that has all 8 omega-3s that you're aware of?
I am not aware of any other that has all 8. Most of the products are made by molecular distillation rather than differentiation. They just distill out what they want. That's not a way to get a real clean fish oil because a lot of the toxins will go out in the distillate. And even if there were another product that had all 8 members of the omega-3 family, the issue isn't not only that those are there and standardized, but also that they're clean.
Right, right.
Which they're not contaminated with pollutants.
And is that how we get the lead out? Is through that molecular differentiation? Did you call it differentiation?
Yeah, that's how they would get the mercury out of the fish and things like that, lead or pesticides, herbicides, whatever.
Okay. Yeah, because I was reading, I went into a very high-class health food store locally, and their fish oil bragged on the label that it only had 20 parts per million of lead. And I was quite shocked to see that they were bragging about that. And I kept reading, and it said that the federal government allows any company to have 40 parts per million of lead in their product because it said that lead is pervasive in the environment. You can't get away from it. So then I could see why they're bragging they only had 20 because they're well below what the federal government allows. But then you look at ours and we have, how much lead is in ours, Jimmy?
Zip. Zero.
Fantastic.
Yeah, one of the, most, not most, but a great number of calcium products have lead contamination.
Wow.
It's, I don't remember the precise number, but it's over 30% of the calcium products sold have lead contamination. And Dr. First explained one time that from the very first day that Neolife introduced a calcium supplement, there was no lead in the calcium product. That's one of the advantages of Neolife is they have always focused on avoiding contamination with heavy metals. I remember talking to Dr. First, and everyone wanted the company to come out with blue-green algae, and he said, "We're never coming out with that. That's way too contaminated."
Yeah, yeah, and he's promoting it to this day. Here's another question. What is good for coming off drug addiction?
We've had pretty good results with both recreational drugs, things like methadone and heroin, And also even more difficult, the psychiatric meds like Prozac and that kind of thing. Those are all very, very hard to get off of. We've had success with a number of people. And what we do is I'll have them do Neolife protein. We have them do like a stress pack. And then I run them through a course of very, very high levels of vitamin C. And we also like to have them do salmon oil.
How does the salmon oil help
It
them?
usually takes about a year to get completely off, depending on how severe the addiction is.
How does the salmon oil and C help for the drug addiction?
C kind of scrubs the opiate receptors in the brain.
Wow.
So it kind of helps break the habit. Some of these people one of them wound up in a mental hospital when she tried to go off the drugs. Had a fellow that was on methadone, been a heroin addict for 17 years, from the time he was 17 to 43. And he was actually able to come off in a few weeks with high dose C and stress pack and Neolife protein. But the C kind of scrubs the receptors and helps break the habit. The salmon oil, excuse me, the salmon oil cleanses the cells of the residues of the allergens. So the more the salmon oil is used, the more improvement we're going to see there.
Okay.
The protein helps to stabilize the blood sugar. A lot of these people have hypoglycemia. Also, there was a study done by a couple of doctors where they found that using a protein with high dose C in a multiple, they were able to get a lot of heroin addicts off of heroin. It's kind of funny how nobody ever follows up on a lot of this research.
Wow. Here's another question. Do we have anything that could help someone with vertigo?
I don't know. Depends on what's causing the vertigo.
What are some potential things that are causes or things that could help for that?
Yeah, it could be caused by damage to the inner ear. It could be caused by allergic responses to foods. It could be caused by a viral or bacterial or fungal infection. Could be caused by head trauma. A lot of different possibilities.
Is there one thing that would help if it was from damage to the inner ear? Is there one or two things that could help for that?
Probably your best bet there would be just to do general supplementation.
Okay.
I always start with a shotgun approach and see what happens. And if that doesn't do it, then we'll try other things. I'd try like Pro Vitality or Stress Pack and add some salmon oil.
Okay. And then here's a question. It says, what would be the most helpful supplements for someone suffering with arthritis?
I have two newsletters I've done recently. You can go to my website and download them. One is on rheumatoid arthritis and the other is on osteoarthritis. So you can go there and you can read my comments on the research that's been done there. Generally, I think something like Pro Vitality, a couple of Pro Vitality a day for rheumatoid arthritis, maybe some extra salmon oil, and then chelated CalMag with extra vitamin D and magnesium would be good. There's a lot of suggestions in that newsletter. In the beginning, with people with rheumatoid arthritis, a lot of them just got on Formula 4, and over a period of several months, they completely recovered. As far as osteoarthritis, osteo is a wear and tear disease. And so what you need to do is try and get the body reducing the inflammation in the joints. And salmon oil helps that. Glucosamine is going to help that, the full motion product. And then I would do some protein and like a Pro Vitality, try and accelerate the healing process. Also, I think vitamin D is really important for osteo. It's important for rheumatoid too. With rheumatoid arthritis, what happens is the immune cells, rheumatoid is an autoimmune where the body attacks its own tissue. And if the immune cells mature in a vitamin D deficient environment, they're much more likely to trigger attack against their own tissue than if the immune cells mature in a vitamin D rich environment. So vitamin D is very, very important for preventing autoimmunity. For osteoarthritis, you cannot get the mineralization going if you're deficient in any of the fat-soluble nutrients, vitamin A and D and K. All of those things are important for healing up the bones, and the health of the bone is what determines the health of the ends of the bones, and the ends of the bones are where the problem is in osteoarthritis. Osteo is an old person's disease. We want to take care of our bones as best we can.
Okay, maybe I could, if a person takes like 9 salmon oil a day, which of course is equal to 3 servings of salmon, is there anything else they need to do? They need to take extra E with that? I hear people say that sometimes.
Yeah, what's going to happen if you do such large amounts of salmon oil is the salmon oil is prone to oxidation. And so usually what I recommend is when you, anything over 3 salmon oil a day, you should take some extra vitamin E with it. And I would do at least 1 vitamin E with every 3 salmon oil. And hopefully you won't need to use such large amounts of salmon oil. Vitamin E and salmon oil work well together, and you're going to get better results using the two together than just trying to load up on a bunch of salmon oil.
Okay, and if someone has a fungal infection, is one of the questions here. How could we help someone with a fungal infection?
It depends on where the fungal infection is, but basically fungus in the body requires 2 things. It requires carbon dioxide and it requires sugar. So when we have a diet high in sugar and we have an accumulation of carbon dioxide in the body, it becomes very difficult to fight off fungal infections. So zinc is how we get carbon dioxide out of the lungs. So zinc supplementation would be important for fighting that fungal infection. And then reducing the sugars in the diet, doing only complex carb rather than simple carbs. One of the problems that we have in our society is we get overly fond of dry foods. By that, I mean things like potato chips and corn chips and crackers and bread and cakes and cookies and all of that. And not only are those all carbs, but it's replacing wet foods in the diet, things like carrots and celery and lettuce. And one of the cells actually hold water in a gel state. That's why if you get stuck with a knife, you don't have a bunch of water come out of you. You get blood, but blood is a gel state of water. And if you want to really be healthy, you need to replenish the gel-like consistency of all the cells of the body. And juicing is a wonderful way to do that. You juice celery and lettuce and carrots and things like that. You're actually filling the body with structured water that comes from all these foods. And it has a tremendous affinity for the cells and bolsters the health of the cells and helps to deal with fungal and bacterial, viral infections and cancer and all of that. And I know Louis is really big on using juicing to fight cancer. And I think there's good precedent for that.
Okay, good. Just a few questions left here. What is good for tissue repair after knee replacement surgery?
Well, we know that there's certain nutrients that accelerate the healing process. Vitamin C, zinc, and protein are the critical ones. Remember, Emmanuel Charaskin told a story about how he was puncturing the gum of his dental students with a dental probe and studying how long it took for the gums to heal. And he said he had to quit his study because he was afraid the probe was going to get stuck in the gum and he wouldn't be able to get it out. So vitamin C accelerates the healing process in a dose-related manner. Zinc, they actually did studies where they wounded rats, and then they put pressure on the wounds, on the healing, to see how effective the healing was with and without zinc supplementation. There was a dramatic improvement in the scabbing and the healing of the wound with zinc supplementation. And the same kind of a thing with protein. Protein is the raw material from which all of that healing is going to take place.
So C and zinc and protein would be very good. And Jim, would salmon oil be important for, would there be typically a lot of inflammation from that knee surgery?
Certainly wouldn't hurt to do a little salmon oil. And I always like to do a multiple. So I do a multiple and maybe a little extra zinc and lots of extra vitamin C.
Okay. And then I don't know if I completely understand this question. You might understand it. This says, is juicing better than fruit or veggie smoothies?
I think they both have their benefits. Juicing would be the removal of the fiber, whereas the smoothies would leave the fiber in. Fiber has its benefits. It normalizes the bowel function. So if you're constipated, you might want to do the smoothie. But if you're very weak and the digestion is very compromised, I would probably do the juicing because it's easier on the digestive tract.
Let's see. Wow, boy, that's a great answer. That is fantastic. And I guess we'll make this the last question. Do you have, I don't even know what this is, but is asking suggestions for, apparently someone has something called microscopic colitis. Have you heard of that, Jim?
I'm not sure what the microscopic, exactly what that's referring to, but colitis is an inflammation of the colon. And so you're going to want to do anti-inflammatories there. I would do acidophilus, aloe, vitamin C. Anytime there's a problem with the gut, I like to do a lot like to try aloe. I like to try powdered vitamin C to see if we can blanket the digestive tract with the anti-inflammatories. I like to do a little salmon oil and see if we can reduce that inflammatory response.
Okay. Well, we thank you profusely, Jim. Such a wealth of knowledge.